Most people are familiar with the process of having blood drawn for various laboratory tests. This process is called phlebotomy. Phlebotomy may be performed by a medical laboratory technologist, a laboratory assistant, or in some cases by a nurse or physician. No matter who is performing the procedure, there are certain processes that must be followed. The phlebotomist should introduce themselves and verify patient identity. They should then briefly explain the procedure. There will be a verification of collection conditions, such as fasting or drug dosage. For purposes of infection control, the phlebotomist will wash their hands with either soap and water or a hand sanitizer and put on gloves. All equipment which is single-use will be assembled. A tourniquet will be applied to the patient's arm. The phlebotomist will select an appropriate venipuncture site. The patient may be asked to make a fist. The vein will be palpated. The phlebotomist will cleanse the site with an alcohol pad, and the site will be given time to dry. Once the site has been cleansed, it should not be repalpated. Next, the vein will be anchored, and the venipuncture will take place. There may be a small degree of discomfort with this procedure. Once the blood begins to flow, the tourniquet will be released. There may be more than one tube of blood collected, depending on the number of tests required. Tubes will be mixed. When the blood collection is complete, the needle will be removed from the arm and pressure will be applied on the site with a gauze pad. You may be asked to apply this pressure with your alternate hand. The phlebotomist will activate the safety device on the needle and dispose of materials used. Tubes will be immediately labeled in clear view of the patient. The phlebotomist will check to ensure that the bleeding has stopped and bandage your arm. He or she will check to ensure you're comfortable. Thank you. Remove their gloves and wash their hands. The College of Medical Laboratory Technologists of Manitoba oversees professional conduct, competencies, and ensures patient protection. Should you have any concerns about your phlebotomy procedure or with a medical laboratory technologist, please contact the CMLTM, the College of Medical Laboratory Technologists of Manitoba. Patient protection is our concern.